to prayer.
असतो मा सद्गमया तमसो मा ज्योतिर्गमया मृत्योर्मामृतं गमय ॐ शान्ति शान्तिः ॐ शान्ति शान्तिः.
Thank you, Anju. When you align your actions with your essence, you become a beacon that amplifies your presence. I am glad to welcome our resource person, Dr. Thomas Cadia, Director of EcoLink Institute, who is addressing us on collective responsibility of higher educational institutions in prevention of substance abuse. It's our honor to have you here with us, sir. Welcome you, sir. With great pleasure, I extend a hearty welcome to our chief guest, Dr. Kiran Kumar, Joint Director, cum Member Secretary, State Tobacco Control Cell, Department of Health and Family Welfare, Bengaluru. Welcome you, sir. It gives me immense pleasure to welcome Dr. M. Selvarajan, Deputy Director, National Tobacco Control Program, Directorate of Health and Family Welfare Services, Bengaluru. Welcome you, sir. I'm honored to welcome Dr. Rajni, Deputy Director, Mental Health Program, Bengaluru, for being with us today. Welcome you, ma'am. A warm welcome is never incomplete without warm words. An appreciative welcome to Mr. Prabhakara, Project Manager, the Union State Tobacco Control Cell, Bangalore. We welcome you, sir. I am pleased to welcome Dr. Juliet CJ, Principal of our college, who is also presiding over this webinar. Dr. Janice Mary, Vice Principal, Professor Vinita, Registrar, Evaluation, Professor Cecilia Govis, IQAC Coordinator, Dr. Sarita D'Souza, Director, CES cum Program Coordinator, and HOD of Postgraduation Department of Criminology and Forensic Science, Deans and Coordinators of Undergraduate and Postgraduate Program, members of Tobacco Control Committee, members of Management, Institute of Social Service, teaching and non-teaching faculty, undergraduate and postgraduate student, and my dear friends for being present in this webinar. Once again, welcome you all. Over to you, Hita.
Good afternoon. Welcome everyone. I am Hita from the Postgraduate Department of Criminology and Forensic Science, School of Social Work, Roshni, Mangaluru, would take this privilege to welcome you all. By Resolution 42 by 112 of 7 December 1987, the General Assembly decided to observe 26 June as the International Day Against Drug Abuse and Illicit Trafficking as an expression of its determination to strengthen action and cooperation to achieve the goal of an international society free of drug abuse. Supported each year by individuals, communities, and various organizations all over the world, this global observance aims to raise awareness of the major problem that illicit drugs represent. In this context, today we are presenting on the theme Collective Responsibility of Higher Educational Institutions in Prevention of Substance Abuse. Without further ado, we will turn the time over to our resource person, Dr. Thomas Carrier. He has completed his doctorate in counseling and psychology on de-addiction and rehabilitation, postgraduate in social work, medical and psychiatric, internationally certified addiction counselor level 2 with certification from Global Center for Credentialing and Certification, Colombo Plan. He is the director of EcoLink Institute of Wellbeing, Mangaluru, India. Director of Automind.com online counseling platform, global trainer under the United Nations Office of Drugs and Crimes, approved training provider for the Colombo Plan Drug Advisory Program, founder director of Link De-Addiction Center, Mangaluru. Awards and recognitions are Spandana Award by the Indian Psychiatric Society for developing community-based models in prevention and treatment, 1997. International Award as Best Reporter of the Year 2000 for Journalism and Creative Reporting. Founder of Link Anti-Addiction Movement in India. Approved training provider for the Colombo Plan Drug Advisory Program. Over to you, sir. I request all the participants to type the questions or any queries in the chat box during the session. At the end of the session, it will be put forth for the discussion.
Okay. So I'm sorry for coming late because I just finished my other program at 1:50 only. So I had a very hurried lunch and came back to your program. Okay, first of all, I should congratulate School of Social Work Roshni Nilaya. Is it audible? Is it audible? Hello, can you hear me?
Yes, yes.
Audible. Okay, only you are not visible. I don't know why you are not visible. Make some of you visible at least. No, let me speak to some people, face to face. Okay, Juliet, ma'am. Nice meeting you. Yes. Good. At least some of you, yeah. Okay. So I should congratulate the School of Social Work. It's very glad news that your campus or our campus is becoming Nashamukta, tobacco free and also substance free campus. I think this is the first campus which is declaring like this in Mangaluru. I'm not aware, maybe St. Agnes must have declared, I don't know. So, but anyway, it's very good that I'm happy to be there with you on this auspicious day to speak to you about share facts on drugs. And that's the theme which we have today: share facts on drugs, save lives. So let me begin. I think I will be okay with my open this. Yeah, and then okay. Can you hear? Can you see the slide?
No, not yet.
It's coming on the way, I think.
Yes.
Now you can see?
Yes.
So before I start, I also thank Sebastian sir. He's there, I think, my good friend.
I'm there.
Okay.
I'm there.
I was there. Okay. So first of all, as I have already told you, congratulations. So that's it. So anyway, so since I was told initially, it's going to become a tobacco-free place first, and then you have also integrated other substances also you have banned from your campus. Great. But it is always nice to begin with what is so much around us, which is tobacco. There's no doubt about tobacco is the #1 killer drug in the world. And it is the most difficult addiction to quit also. Many people say that it is very easy to quit. I have done it several times. Means they go back to it, they come back to it, they go back to it like that. Because cigarettes are available everywhere and tobacco chewing is very much available. Because of that, actually, people find it very, very difficult to stop it. Some of the very glaring, frightening data I would like to share with you. Of course, the tobacco products have got around 5,000 toxic substances, and the most dangerous substance is nicotine, which makes us addicted to that, and also which makes us behave in a different way. And we have carbon monoxide and tar, which causes a lot of respiratory issues in our system. And see, in India, it is it's mentioned under the same site of your tobacco control board, so around 35% of adults, in India, they use tobacco in one form or the other. Some of them smoke, some of them chew. Chewing is also very common. I know from when I was studying in Roshni itself, we have done a small study about the chewing of tobacco among the drivers, auto rickshaw and bus drivers and all. Even that time, almost 70-80% of them were chewing tobacco while driving. So it's very much, actually chewing is much more dangerous than smoking, because it affects your system faster also. And India has around 275 million tobacco users, of which 163.7 million they use only smoking, and around 42.3 million use both smoking and chewing. Especially in northern states, like we have more of tobacco chewing than tobacco smoking. And WHO's some records say that more than 6 million people die of just tobacco related ailments every year, not in India but globally, so that's something very little bit frightening. So we have to little frighten also, like since you have taken such a bold step to keep tobacco away from the campus. So let us know the benefits, like we are going to breathe. Like as I told you, tobacco is the substance which makes a person addicted to it. And this one, of course, I don't want to spend much time on this. Anyway, I'll share this slide with you already. Like you can take that copy, it's no issue. There is no organs in our body which is not actually getting affected by tobacco, mainly because tobacco smoking, it goes direct into the brain. Any addiction is a brain disease, and brain controls the whole system in our body, all our movements, our thinking, our behavior, our feeling, and the functioning of every organ is actually being the computer is the brain. And then it comes respiratory problem, lung cancer. There's so many things. Whenever we speak about tobacco, immediately we speak about cancer. It is very, very close relation. You go to any cancer ward in any hospital, you will be shocked to see so many people who are affected by cancer just because of the tobacco smoking. Okay, now let me just give you a brief overview of addiction, the drug abuse in the world. First of all, we should understand this has been always there with us from time immemorial. Maybe when Adam and Eve was in the the garden, there must have been some sort of a stuff there also, natural stuff. Most of the drugs are natural, so this was there with us in our culture from the time immemorial. We had the use of drugs in the history. So just look at some of the sadhus, of the previously, they used to use hashish and marijuana in different forms, to get kick. In some other countries, I could say the statues, old statues, which is thousands of years ago, they have made statues with looks like mushroom, you have. Shows that people have been enjoying that sort of a, what is that, hallucinogens effect, they were enjoying that those days also. Coming back to the third picture, the new generation, of course, so they have taken it in a different way. That's why yesterday the World Drug Report was released, yesterday or day before yesterday. Every year during Drug Awareness Day, Drug Anti-Drugs Day, they release the World Drug Report. According to that report, we have 275 million people using drugs worldwide. Out of that, around 36 million people are actually having drug use disorder, means addiction. Drug use disorder is the name now the professionals use now. Instead of calling somebody addict, they use these persons with this problem, persons with drug use disorder. And another very revealing data was cannabis use. What do you call ganja, which is very popular, which is very common everywhere, every college campuses or outside we get that. So that has become a big concern now in the world. Some countries have already made it legalized, thinking that let people not get in conflict with the legal problem and let them use it responsibly and all. But there is nothing called responsible use of substances. People become irresponsible automatically. As the addiction develops, they become definitely it goes out of their system, so there is no responsible use. So people develop addiction. It leads to depression. It leads to psychotic disorders. In many countries, even in America, it is from 7%, it has gone into 14%. They almost doubled in many countries. So cannabis is another big issue which we are facing now. When you say you're smoke-free campus, it is also means that no cannabis-free campus. Now, just a small little bit of immediate understanding in a very simple terminology. So what is drug? I mean, drugs, when we say drug, sometimes we can say, no, medical shops, when we go also, whatever medicine we are buying, they are drugs. Some places they used to write drug store, no, instead of medical store also. So that also can be drugs. But in simple terms, we need to understand any pharmaceutical preparation or even natural stuff, if it is designed to make a change in our metabolism, in our physiological and psychological state, our mood, our behavior, and our feelings, then we can say that is drug. Anything other than food doesn't make that kind of a sudden changes into our mental systems and all. So that is small understanding of the term drugs. And this is something very interesting. You may think like, no, drugs have come from somewhere, somebody has trafficked into our country and they're selling, they're pushing, they're peddling and all lot of things. But amazingly, you will understand most of these drugs have its roots from the nature. The Mother Earth has actually, provided all this stuff not to the people. Maybe thinking that let them enjoy a little bit, but now God maybe understanding that there is no responsible use among the people. So just look at that. Nicotine coming from where? From tobacco. Caffeine is coming from coffee. Cocaine is coming from coca plant, coca plant. And heroin is from poppy plant. I was in Afghanistan for 2 years. I've seen the beautiful plantations of the poppy plants. Like that's like every the farmer, they cultivate that. Like it's one source of income for them. So heroin from poppy plant and marijuana from cannabis plant, or we call it ganja plant. And even alcohol is made from fruits, grain, vegetable, decomposed. So and medicines are made from both natural or synthetic chemicals. Like so, you see that 90% of the drugs, not in the way that we receive it, but it has its root in the nature itself. So they are taken from the the natural sources, and then they make it process and like make it so synthetic and so dangerous and which makes people addicted to that. So this is one simple thing which you need to understand when we speak about drugs. This is around us. Now, if I ask you, I don't know how many of you will speak to me. So even if you don't show me, no problem. Just tell me one or two people, why people take drugs. In spite of the fact that they understand, it is harmful and some people get addicted and all. Why do you think people take drugs? If I can hear some voices. Anybody? Anybody?
Depression, sir.
Depression, okay. Yeah, okay. Anybody else?
Sir, it may be due to pleasure.
Fine. Just the opposite of depression. Anything else?
Curiosity, sir. Curiosity.
Curiosity. Wonderful. Yes, yes. Okay. Anything more?
Influence of friends.
Friends and influence on friends. Okay. Okay.
That it's a fad.
Uh-huh.
And also that nothing will happen to me. That is
that overconfidence, overconfidence. We think that nothing will happen to me. I can stop at any time I want. Let me try it out what it is, out of curiosity. Any other answers from anybody?
Some are afraid to face the reality of the life. So they are depends on the.
So they try to withdraw from the reality, like so they just don't want to face the reality, or don't want to don't have enough of confidence in life. So they think that this will sometimes boost their confidence. Fine. Anybody else? That's it? Okay. But it is quite, natural. Like whenever, wherever in the schools, colleges, I ask this question, very often the first answer is depression. Because people are upset, people have failed in their love or failed in exam, or there's something which is missing and I'm not happy, and then I go for drugs or alcohol. So that's one common thinking people have got. But I would definitely accept the second answer from Chandana, because she says people take it for pleasure. I would like to definitely make it clear to you, nobody gets into drugs just because they are upset and they have lost everything. These are all only in the Bollywood films you see, all these stories they show. they lost things and then they go and they start drinking. It's all bullshit. 99% of people get into drugs because just they want to enjoy it. No, they want to get some pleasure out of it because their friends are doing. Somebody said it is correct also. And another very important reason is curiosity. People take it because they just want to see what it is. Many people tell, don't take it. So I have all the more a curiosity to just take and see what it is, what changes it will bring into me and things like that. No, so curiosity kills. No, curiosity is another very important thing. And some of you have said about the peer pressure, no doubt. Even if students who come from very good families, very happy families, sometimes when they come out, they like to reduce their link with the family and increase their link with their peers. That happens in the process of getting adjusted to the peer acceptance to the thing. People will take that adjustment. Let me take it a little, otherwise I cannot belong to their group. So let me have some drinks or let me have some cannabis with them so that I become part of their group. So everybody want to belong somewhere. So it also will happen as a adjustment so. And then when is this depression coming? I tell you, it is later. Once you start taking it and then your friends have started going away from it and you started emptying your pocket, you're getting in conflict with your family and all lot of problems increases in your thing, you start failing your exam and all this, then depression begins, and then you will definitely get into drugs to get sleep and things like that. But not for the first time when they get into it. We cannot say that they are doing it because they lost their friendship with your wife. Okay, yeah, these are some to feel better, to do better. These are all some of the things. Curiosity, of course, it is there, and because friends are doing, I'm doing things like that. Okay. And just a few terms which you need to be very clear about when we say drug use. So when I said Mother Earth has given us all this stuff, all this thing, even poppy plants are medicinal plants, everything has got a medicinal thing. Poppy is actually being used now to make opium. Opium was made into morphine. Morphine was used in our medical for delivery and for surgery and all. They were using it as a painkiller. And then they understood that this is creating problem, and then they no longer use that kind of stuff also. So every drug has got a use and abuse and addiction prospect. So if you are taking a drugs to treat an illness or prevent a disease or improve your health condition, we can say it is drug use. And the same drugs, if you are taking for any other reasons, like other than medical reason, we can say it is an abuse. For example, doctor prescribes like for 1 week sleeping tablet for you because you cannot sleep, and then later you decide, I don't need to go to the doctor and give a consultation fee, let me continue to take it. And he knows how to get it, go a different way. And that is abuse. And over a period of abuse, anybody can develop addiction. Addiction is a dependency. You depend upon that stuff to feel normal. It's a dependency, physical dependency and psychological dependency. So even if some people think in the morning, okay, let me not take drugs in the evening or alcohol in the evening, but when the evening comes, body will tell, no, I need it. If I don't get it, my hands will be shivering. If I don't get it, I will not get sleep. So better you give. So like that, it is both physic and psychic, like both things together. It makes the thing. Then there are legal and illegal drugs. Some people think that legal drugs like alcohol or tobacco or medicines, it's okay because government is providing us. It is licensed to show. We are paying tax for that, so we can take it. So it's not true. And there are other illegal drugs like narcotics, cannabis, opioids, cocaine, anything like there are so many things, hallucinogens are there. So those things, government is not getting income from that. There is absolutely no sort of a tax in that, so it is called illegal. That's all. Legal and illegal, it is only based on the tax what we are paying government. So it doesn't mean that if you take legal you are safe, illegal only you are in trouble. Nothing like that. Legal and illegal same. You can get addicted to that. Okay. So some of the stuff what we see in the society. What are the drugs? Just can I hear from you a little bit? some names of the substance, like it can be legal, it can be illegal, no problem. Let me hear from you. Tuck, tuck, tuck. No, sir. We don't have much time, I think. Yeah.
Alcohol.
Alcohol, very good. It's a substance. Okay.
Cocaine.
Cocaine, yes.
Tobacco.
Tobacco is also, tobacco means the nicotine inside the tobacco is a psychoactive substance, yes. Okay.
Heroin, sir.
Heroin, okay, right, correct. Yes. Heroin is coming from where?
Cannabis.
Actually? Cannabis, yes, yes, okay. Okay.
Opium.
Opium, yeah. So opium, heroin, and all is same family, okay? Opium, morphine, like heroin. And we have an Indian name for heroin. What is it? Anybody knows? Brown sugar. Have you heard about brown sugar?
Yes, sir.
Yeah.
Yes,
So
sir.
that is nothing but it is actually adulterated heroin. Okay. So the heroin is very expensive. The refined heroin will cost so much. You know how much it will cost? 1 kg of heroin in the international market? No idea, no? It's more than 1 crore, okay? It is much more than that, 1 crore for one kg of heroin is such a costly thing. And that's why that India is a developing country, and like we cannot afford sometimes. That's why they have mixed it with all lot of things like tar and carbon and like battery shells and then rat poison, so many things, and then they made something called brown sugar, which is 1 kg of heroin has become 10 kg of brown sugar, and that is only available in our Indian streets. It is much more dangerous than the refined heroin also, because you get so many other issues also from that. So like that. So even in alcohol, we have different things. Brands are there. I don't need to ask you. I know you all know about that. So normally, like we can classify them into tobacco. We get tobacco is a stimulant. Okay. It's a stimulant drug. I just give you some idea once after this one. Alcohol, any form, beer or wine or hard liquor or anything, is called depressant. Sometimes we feel when we take alcohol, we feel high, we dance and we sing, and we have all funny things, and we think it is a stimulant. No, it depresses your central nervous system. Sometimes you lose your inhibition, and then you start acting very funny. That's all. So that's why people who are addicted to alcohol, without alcohol, they cannot get sleep. So they need to be sedated. They need to sleep with this only. It's a depressant. Cannabis is also it doesn't come into. It has it share both stimulant and depressive nature also. And we have heroin. We have spoken about cocaine and amphetamines are also stimulants. They are under the stimulants. And we have medically used prescription drugs. Now, in the current world report, they also have mentioned about the prescription drugs. Even prescription drugs also is becoming a big concern now. Cannabis and prescription drugs in the world, which is actually posing a big crisis now, because they mimic heroin. Whatever the other stuff, when it is not available, you have the same thing available in the medical store in different names. People who are addicted to that, they know about that. So prescription drugs also, it's another big mafia. I tell you, it is much more powerful mafia than the illegal drugs world, the medical world itself. There are so many unethical things happening in that. So this is just for you. I won't take much time about this classifications of drugs. We have basically 4 classifications. One is stimulants, which stimulate our central nervous system and keep us awake. That's why a lot of people, when they are in the exam time and all, they use stimulants like and then amphetamines and that kind of things to keep themselves awake. And then sports people use amphetamines, methamphetamine and all to increase their power, to run and things like that. So it is something called stimulants. Opioids, narcotics, that is coming from the poppy plants. All these heroin, morphine, opium, and brown sugar and demerol, all these are belonging to narcotics family, which has the root in poppy plants. Okay, from poppy plants they make opium. From maybe the most refined form of opium is actually heroin. from maybe 10 kg or 100 kg, you make 1 kg of heroin, no, like that, no, it refine. That's why it's very expensive. And depressants, no, alcohol, barbiturates, benzodiazepines, all these things are coming under depressant category. And then the most popular drugs with the youngsters, party drugs, LSD and ecstasy, mushrooms, all these things are hallucinogens, okay? The mushroom category. Cannabis is not coming under any of these, but because they share the same nature of, you know, different classes, and that's why it is classified as a fifth category. And we say addiction, drugs, like, no, it is because it is psychoactive substances. That is the terminology we use now scientifically. Psychoactive substances, whatever which makes a change in our system, which can change or alter the way that we look at things, the way like we think, way like we feel, and how we behave. All these areas, the mood, thoughts, sensory perceptions, and behavior. If any drugs can make a change in all these areas, we say that this is psychoactive substance. Okay. Now, one important thing when people start taking drugs, maybe peer pressure, maybe curiosity, or maybe for pleasure, or maybe for pain, whatever it is, when they start taking it, none of them will think that they will become addicted to that. They are so confident that it is not going to happen to me. I know many people who are addicted, but I know when I come to that level, I will stop. So that overconfidence is there, and that's the formula which is used in defining addiction. That's why we have got rich and poor, educated and non-educated, all class of people in falling into the addiction, because till they are in the rock bottom, they don't understand they are addicted. They think they can manage. They think they have not gone up to that level. So that kind of things are there. So you need to understand addiction is a disease. This is a disease just like any other sort of disease, which has got an etiology, which is got an external agent. It's a chronic disease. All those symptoms, signs and symptoms, all these are there, and which has been approved by World Health Organization, American Psychiatric Association from 1935, when AA was founded. That time itself they understood that there is a disease concept in that. That's why they have accepted that unmanageability. Once we cannot control, if I can control my COVID in my system, then why should I fear? I have no control. The virus can come at any time and attack me and make me into that, like COVID, corona, I can get. So like this, that has to come from outside. But this is also we only people who start taking will become addicted. If you don't take it, of course, you have no chances to become addicted to that. So just to define in short for what is addiction, understand very clearly the words in that. Addiction is a chronic, relapsing brain disease that is characterized by compulsive substance seeking use despite harmful consequences. There are 4 or 5 words which are very important in that. One is, it is chronic, means once you get it, you always have it. You cannot get cure from that. This is like diabetes, or blood pressure or something. There is no cure for that. You can only arrest it, you can only control it, you can only stay away from that. So addiction is also a chronic disease, and similar way, it is a relapsing brain disease. It is brain disease, that is important. It is also relapsing. Not that once you get treated and you are out of it altogether. We cannot say that. Sometimes they can go back to it. Relapses are possible because man is a human person. That temptations are there and craving is that dopamine is there. So chances are there, people. And relapses has to be used as a way to proper recovery. It is nice 1 or 2 times they relapse, so that they get to know the difference between being sober and being into addiction. There's a day and night difference, and then they recover well. Many people who successfully recovered, who have completed 30 years, 25 years in sobriety, are people who have relapsed 2, 3, 4, 5 times in the beginning. and then they understand, and then they use some system like to continue in sobriety. Yes. So there are stages, there are symptoms, there are sort of characteristic syndrome also. That is all part of the disease. So this is another thing which you need to understand: brain disease. Like addiction is a brain disease. So the disease get formed in our brain, and brain has different functions. There are certain part of the brain is about life systems like breathing and things like that. They control that. Certain part is for thinking. Certain parts is for actually like what happened? Yeah, like that. Anything is possible. Like different parts of the body is with the different purposes. Can you hear me all? Can you hear me?
Yes, yes, sir.
Yes,
Okay.
sir.
Yes, sir.
Yeah, there was some change. Okay, so understand addiction as a brain disease, and that's why we say like people have they need to understand that the brain get affected very much, and that's how people develop different symptoms. So understand it as a brain disease, brain communication and things like that. It affects. And another thing which you need to understand is the symptoms or signs of a person getting addiction. Like the first sign a person can feel is tolerance, increased tolerance. Like especially people who drink alcohol, they may start with wine or they may start with a glass of beer, and things are okay, they enjoy everything, but after some time in another occasion, they realizes that this one glass is not making any changes in them, so they need 2 glasses, or they need to shift into another harder form of liquor to get the same kick. So that is called increased tolerance. Your body is becoming is receiving capacity is increasing. So many people misunderstand that. Some people say that first time when I drank, of course I vomited and it was very bad experience for me, but now I have mastered it. Now I can drink nicely. Even 2 bottles of beer also, if I drink, nothing will happen. I can still walk in 2 legs. So people misunderstand that. They're thinking if they get to that kind of a feeling, they are mastered addiction. Actually, it is just opposite. Anyone who is feeling that increased tolerance is a person who is actually moving towards addiction. That is the first sign a person is getting into addiction. There are people who continue to be a social drinker all throughout their life, but they don't take more than a particular quantity, like 60 or 30 or whatever. They have a particular amount of alcohol which they take, and it doesn't go beyond that. And that's why they are lucky people. Maybe that's how we need to understand. Some people are unlucky. They get into addiction. It develops as a disease. They develop increased tolerance and things like that. And then psychological dependence, physical dependence, withdrawal symptoms. So when you grow in addiction day by day, you will realize one day if you don't drink or one day you don't take a drugs, your body will start reacting. That reactions are called withdrawal syndromes. Okay, so your hands will be shivering, you won't get sleep, and you get angry and you cannot concentrate on anything. So then what they will do, they will continue to drink. If they don't drink, they cannot come to a normal sort of cannot feel normal like other people. So that's the thing. So this is the progression of addiction, just for you to understand how a person, when they start taking alcohol or drugs, how it progresses in their life. This is the first stage, like progression stage number 1. He has all priorities in his life. He has family. He has interest in the food, work, and study, and school, and friends, and sports, everything. His priorities are not much affected, but he gets into substance also get into your world of priorities in a small way. And that time, of course, he won't understand, because still he keeps his friends, still he is good in his sports, still he is studying very well, and he won't understand a difference. But at the same time, he understands substance is also becoming one of the priorities in his life. This is stage number 1. Stage number 2, there are some differences. You see, substance It was only in 2 places I have shown in the last slide. Now it is in the four places. Means it is growing as a priority, like more priority. And then when it is growing as more priority, slowly other things will lose its priority. Maybe he will compromise with his studies. Maybe he will compromise with his friends, and he will avoid some friends, and he will become friends only with those people who are drinking or are taking drugs. And family he will try to keep away. So all these kinds of things are normally happening in the second stage. So the priorities are changing, not changing, it is actually coming down. No, the life priorities come down and this goes up. In the third stage, what happened is that unfortunately you have only substance in the system, only substance, no, like nothing, no other priority. You cannot think about your family, you cannot think about your job, your friends, your social relation, your college, your studies, nothing, everything is gone. So you fill yourself with all the substance, and there you have no, it's not that easy to come out of that. And you know, he needs very good treatment to come out of that. I mean, that is how people come, no, like they may not understand. Increased tolerance and all is one part of it, and then as you know, day by day, like no, they realize their priorities go. That's why when we look at addicts or alcoholics, we say they are irresponsible people. They don't take care of their family, they have problem with the family, and they're fighting, all those things. This is how it happens. So I just want to, like, I have another 3-4 minutes now, madam. How much, Juliet, ma'am? 5 minutes more?
Yes, sir.
Okay, I'll take 5 more minutes to complete my presentation. Okay, fine. Yeah, so you need to understand addiction is a progressive disease. It progresses from 0, 1, 2, 3, 4, like that. You know, it grows like that only. There is nothing like you go up to 5 and come back to 3 and then go up to 6, nothing like. No, it always, it progresses. So our attitude may change a little, but still it's a progressive, it's a permanent, and it's a terminal disease. Any addiction is a permanent and terminal thing. It's very unfortunate, but that is how it is designed. It is like diabetes. Once you get it, it is always with you. Even if you stay away from this for 10 years, still on the 11th year, if you think, okay, let me have a glass of beer, he will go back to it. That is how, no, because it's all in the brain. It's already, processed and, kept like a program. You just touch it, it gets exploded. So there are physical and psychological dependency, and then it passes through 3 stages of dependency, like early stages, middle stages, and chronic stage. Just for you to understand things better, just imagine that I am going to discuss about alcohol, because that is something so much around us. People get into it very fast, very easily, because any function, any parties, you take that. So in the early stages, what happens, you see, preoccupation. Like I have I developed some sort of a interest in that. I like it. So I am just waiting for when is the next occasion. Oh my God, now nothing is coming. Or when is Saturday coming, weekend, so I can drink. So that preoccupation is one sign in the early stages. Another sign I have already explained, increased tolerance. Your capacity will increase. You need more quantity of alcohol to get the same kick. And then you also, along with that, you develop your overconfidence. You think I can control at any time. This is I know what I am doing, and things like that. And sometimes they shift from one to other priority. They shift their priorities. Sometimes they shift their things like that. In the middle stages, main problem is loss of control. Loss of control means you go to a bar thinking that let me have just 60 ml of whiskey today. So I won't take more. I have to go home. I have a party at home. My daughter is waiting, and that and this and all. But once you go and start taking that 60 ml, he forgets all other things. And 60 will go into 120, and it can go into 1/4. Sometimes it go into the other day. I had a client, a teacher, very sorry to say, from somewhere else, of course, not from Mangaluru. 1 full bottle of whiskey he finishes every day. So that tolerance is very high, it goes into that. So he loses control. Once you lose control, what happened? If you lose control when you are driving, what happened? You go and hit somebody, or you may fall down, and you may get into accident. So there you are not the only one who will suffer. You will hit somebody, and that fellow also will die sometimes. So your family will get affected, your friends will get affected, your social relations will get affected, your economy will get so much affected, and along with all this affecting, all these are happening, that time he will also develop his denial ambivalence thing for justifying this cover up, that defense mechanism also he will use. So he will successfully graduate into the chronic stage. That is how it grows. You don't catch them in the early and middle stage very often because they are very confident, they don't have so big problems, so somehow they will escape and will come into the chronic stage. And that is a stage we are able to look for them to get treated and things like that, but it will be too late also. So there they have an acute health problem, their liver will be damaged, their heart will be damaged, and they have another thing called decreased tolerance. You cannot drink too much that time. When you are in the chronic stage, you need to take small into different, multiply into many times. Earlier, you were able to, in one stretch, you were able to drink 1 quarter. Now it's not possible. You will collapse and die. So, but slow. That is why that one bottle, I asked him, are you taking it at a time? Or then he said, no, from morning he starts, little. He finishes by evening 1 bottle, like that. Then they develop also psychotic issues. Paranoia is very common, suspicion of his wife, because he is already get affected by his sexual life, everything, and so he will develop also suspicion, paranoia about his family. It will lead to also domestic violence and fighting, things like that. Delusions, hallucination, seeing things which are actually not there, hearing things which are not there, phobia, social phobia, all these are the co-occurring disorders are very, very much possible. Normally with SUD person, around 50% of them also have got some sort of psychological issues, like depression is very common, anxiety related disorders are very common, suicidal ideation is very common, and they can also get into other serious complication. And physically, medical also, tuberculosis or HIV or any that kind of things are also very much possible. So this is the same thing. There are physical deterioration, psychiatric problems, personality problems, intellectual impairment. You cannot study, you can get into accidents, you can get into legal problems, crimes and things like that. So with all these things, you read that last one in the red mark, willpower, intelligence or personality traits or your education will not be able to save you. Nothing can save you once you come to this stage. And of course, when you are starting to do prevention program in your college, always you just Google, you can see what are the risk and protective factors. Risk factors which will force more of addiction tendency among the youth. You try to help people not to stay away from such risk factors. And then protective factors, you give them alternatives, get them involved very creatively, get them, give them more recognition, give them life skills, and give them more confidence, self-esteem. Those kinds of things will definitely will help a person to, I don't need drugs to boost my confidence. I can even otherwise I can boost my confidence. I can keep my friends always with me. I can be a successful person. The other day I have a small child, 20-year-old from one of the very prestigious engineering college, 20-year-old boy, but he had started taking drugs from his 14 age itself, he has come to a particular level now. Yeah, so that kind of cases, many are there in Mangaluru. Mind you, it is a reality. Many colleges are actually suffering. They are just denying. They just close their eyes and say, we don't have a problem. But when they come to us, they say, we picked up from that college and this college. So this is very much there. And one Dr. Yathan was saying last webinar, there is no point in telling young people don't take. Don't even say that, but give them positive or other things, where they will feel that same kick. They feel good. They feel like they can be more creative in their life, like that. This is my last slide. Just an example, when you wanted to declare your campus as drug-free, it also means you need to keep that rhythm moving, so you need to involve the students. You have to give them a lot of creative opportunities. For my students, I'm running a training institute for addiction professionals. I have around 150 students from 16 countries. I just told them, just send a message to them See, 26th of June is International Drug Awareness Day. You are a student in SUD. Please try to do something you can to promote awareness about this. Whatever thing you can put a maybe a status in social media or anything like that. But they have come out with lots of programs. Today we have got a sort of a culmination of that at 6 o'clock. We recognize that everybody has a potential. Every student has a potential to do something, to tell the message to other, at least, no, like, so this, like, no, we have 100 program challenge we call. I think we are getting more than 100 programs also. So like this, keep them occupied. So that's what, this is a beautiful picture. This is a thank you thing. Last slide. Don't stop it. Yeah, why I even say is, so this is poppy plantation, no, Afghanistan. I was there for 2 years. I have seen face to face, no, some of these plantations, very beautiful. But from this, heroin comes. The flowers are so beautiful flower, but after flower falls, no, there is a stuff that one, no, can be converted into, no, destructive drugs from whatever is beautiful. Initially, everything looks beautiful, but things can happen in a different way also. So towards end, please understand that. I end my session here. Any 1 or 2 questions I can answer, because 3 o'clock I have another program here. So sorry if I take a little more time than I expected. Hello. So thank you. Any questions?
Hello.
Yeah.
Hello.
Okay.
Hello, Chandra. Yes, I'm here.
It's coming from our team. You just
Oh,
sorry, it is from
good
our.
afternoon.
Thank you, sir. If anyone has any questions and queries, please put forth in the chat box.
Thomas sir, please unmute yourself.
Yes.
Thomas sir, please unmute yourself.
Okay, fine. Anything? Any questions? Or please
It's in the chat
yeah.
box, sir.
Thank you. So shall I take leave because I have something else?
Sir, there's a question in the
Okay, tell
chat
me.
box.
Can somebody read it out for me?
Will long-term medication falls under addiction?
Long-term medication falls under addiction, definitely. People can get addicted to certain drugs, especially psychiatric drugs. Many people know, even without the prescription, without the doctor's advice, they just continue with that. Some of the medical shop, they give it also, no? They are not supposed to give without a prescription. Any medicine, even paracetamol, I tell you, is addictive. It can create addiction. So don't think that no medicines are safe, especially anything which is painkiller effect, sedative effects like benzopine or no sleeping pills. Even there are people who abuse what is that? Everything, no, like spirit, everything. Even the sanitizer also people take, no, like every medicine is addictive unless you take it with a prescription with a correct dose. Okay. Any other question? Yeah.
Sir, many people use addiction-free medicines or no addiction medicines, right? Like, will that help them to come out of addiction even they are not ready for it?
That is very dangerous thing. There are so many people who claims like, no, you take this medicine without the knowledge of the patient, give them and they will be all right and all. It is very dangerous. First of all, no, like it is not even ethical like that, not to, it is against the ethical guidelines even to give a medicine to somebody to stop something without he knowing. And it is very dangerous also. I think I don't recommend to do anything like that. It is only with the consent of the patient we should do. And that motivation building is the challenge of the, the therapist. Yeah, therapists have to definitely take up that responsibility. You don't give any medicine to anybody without he knowing.
Okay, sir. Thank you.
Yeah.
Thank you, sir. Can we have a minute from your side?
Okay.
Yeah. Due to preoccupied schedule, our resource person, Dr. Thomas Carrier, would leave the session now. Hence, I would like to acknowledge his presence for making some time from his busy schedule. consenting to speak on the theme of the webinar, and being here with us to share his experience and knowledge. Thank you, sir.
And we also would like to acknowledge you have always made your alma mater proud.
Yeah, alumni of yours.
Yes,
Okay.
Dr. Thomas is our alumni and has always pioneered. He has pioneered in the field of addiction treatment, and especially with regard to, I remember, with the community rehabilitation programs, as well as with Alteen and Al-Anon groups that you have initiated in Mangalore. All these were your pioneering efforts. We are really proud of you. Thank you for being with us and with our team today.
Thank you very much. Thanks all. Bye-bye. You can continue. See you again some other time. Thank you, Sebastian.
Thank you, sir.
Thank you, sir. Thank you.
Once again, we again acknowledge the presence. With great pleasure, I extend heartily welcome to our chief guest, Dr. Kiran Kumar, Joint Director, Medical Secretary, State Tobacco Control Cell, Department of Health and Family Welfare, Bangalore. Welcome you, sir. It gives me immense pleasure to welcome Dr. M. Selvarajan, Deputy Director, National Tobacco Control Program, Directorate of Health and Family Welfare Services, Bengaluru. Welcome you, sir. I'm honored to welcome Dr. Rajni, Deputy Director, Mental Health Program, Bangalore, for being with us today. Welcome you, ma'am. Over to you, Hita.
Thank you.
The Government of India launched the National Tobacco Control Program (NTCP) in the year 2007-8 during the 11th Five-Year Plan program with the aim to create awareness about the harmful effects of tobacco consumption, reduce the production and supply of tobacco products, ensure effective implementation of the provisions under the Cigarettes and Other Tobacco Products Act 2003, help the people quit tobacco use, facilitate implementation of strategies for prevention and control of tobacco advocated by WHO Framework Convention of Tobacco Control. NTCP is implemented through a three-tier structure, that is, National Tobacco Control Cell (NTCC) at the central level, State Tobacco Control Cell (STCC) at the state level, District Tobacco Control Cell (DTCC) at the district level. There is also a provision of setting up tobacco cessation service at district level. Currently, the program is being implemented in all 36 states and union territories, covering over 600 districts over the country. Without further ado, now I request our guest of honor, Dr. Rajni, Deputy Director of Mental Health Program, to address us. Over to you, ma'am.
Yeah, good afternoon, everybody. I think it's a post, lunch session, and keeping everybody awake is also a challenge. So today, as all of us know, it is an International Day Against Drug Abuse and Illicit Trafficking. And in this COVID situation, I think many of already we have heard from Dr. Thomas how these drugs, it starts and how the tolerance develops, how addiction develops. I am a psychiatrist and I'm working as Deputy Director of Mental Health in Government of Karnataka Department of Health and Family Welfare Services. And of course, as he rightly mentioned, tobacco is the gateway drug for most of the drugs, how it starts. Usually, if you see the trend nowadays, it starts from even school age group. So it starts with curiosity, modeling from parents, or various, causes in youth and adult, again, modeling behind others, peer pressure, stressors. So various reasons are there why, how they start. But as we know, it usually starts with a small dose. That is, for example, if you take alcohol or a cigarette, it starts with one cigarette, then it goes to 3, 5, 10, 30, 80. I had a principal who came for treatment with hematemesis, that is, vomiting of blood. So he used to smoke around 80 cigarettes per day. And alcohol also, similarly, it starts from 30 ml, then 60, 90, 180, and then, there is no limit. So this is how it creates tolerance. And initially, people feel that they have, full control over these tobacco, alcohol, and other drugs, but gradually, it changes the brain structure itself, and the craving, tolerance, salience, all these things will push them to addiction. So without wasting time, I think it is very, very important that each one of the citizens do their bit of work in the community, and it is our responsibility to share the real facts about the drugs and save lives. So that is the theme of this year's International Day Against Drug Abuse and Illicit Trafficking also. So this is a very wonderful program what you have been doing. I can see, I know I saw more than 90 participants were there. I am sure it will have a cascading effect, and you would go share this good message with everybody. The best thing is not to start on drugs, but if somebody is already dependent or using drugs, abusing drugs, or having harmful use, it is like green zone. It is like traffic signal, green, orange, and red. So see where you are. If you are in green, if you have not started any tobacco, alcohol, and illicit drugs, please don't start. Be in green. By chance, if you have started, if you are in the orange zone, that you have just started, and because of peer pressure or some stress or something, so please move back to the green zone. But unfortunately, if you are already in the red zone, that is, you are dependent on alcohol or illicit drugs or any other substance, there are wonderful treatments, de-addiction and detoxification, which can be done. So please meet a psychiatrist, psychologist, social worker, mental health professionals who can really help. Talk to your friends who have quit drugs, and talk to the mental health professionals, and please do take help. So I had this young boy who had started cannabis, alcohol, tobacco, and all around at the age of somewhere around 12 years of age. So because he had become completely dependent on cannabis, alcohol, and tobacco by the age of he was in second year engineering. That to be precise, around 18, 19 year of old age. So he was finding it very difficult to concentrate on studies. He was going through depression, so severe withdrawal symptoms when he tried to leave. So the success story is like he came very meticulously for counseling. He took treatment also, and today he is out of addiction. So that is, so if I start telling, there are n number of stories. I was a prison psychiatrist where we used to treat huge number of people who were dependent on cannabis, and they have all started new life. Many of them have started new life out of addiction. So addiction is a very, very big brain disease which will cause social problems, economic problems, and legal problems. Because of that, many even get into accidents, and they enter jails, and they lose a lot of money. They lose family love, care, affection, responsibility. So I request each one of you, I'm sure you're all working towards that, each one of us should do our bit and make this world drug free. I'm sure, I don't know, that should be the dream what we should have. So thank you very much for this opportunity. Thank you all. Have a good day.
Thank you, ma'am. Now we will turn the time over to our speaker and chief guest, Dr. Kiran Kumar, Joint Director, Member Secretary, State Tobacco Control Cell, Department of Health and Family Welfare, Bengaluru. Over to you, sir.
Prabhakar, are you there?
Yes, sir. I'm there, sir.
JD join ಆಗಿದ್ದಾರಾ?
How, sir? ಆಗ್ಲೇ ಜಾಯಿನ್ ಆಗಿದ್ರು. I think he left the meeting. ಈಗ ಕಾಣಿಸ್ತಾ ಇಲ್ಲ ಅವರು. Madam, you can call Dr. Selvaraj. Dr. Kiran is not here. I think maybe connectivity issue, lost the connection. You can call Dr. Selvaraj.
Okay, sir.
Yeah.
Our next speaker and guest of honor, Dr. N. Selvarajan, Deputy Director, Medical and State Program Officer, NTCP, Directorate of Health and Family Welfare Services, Bengaluru. Over to you, sir.
Hope I'm audible, ma?
Yes, sir. Yes, sir.
Yes, sir.
You're audible.
Okay. Okay. Very good afternoon to all the, what they call children born after 1984. They call all children born after 1984 as millennials.
Sir, your voice is feeble.
Hello. Am I audible? Hello. Am I audible, ma?
Yes, sir. Yes,
You're
sir.
audible.
Yeah. So the current 90 plus participants who are here, you come under the category of millennials, most pampered generation. That's what these people, all children born after 1984 are called. So thanks to be part of this millennial group. I was just reading an article in today's newspaper, and it says that drugs worth 50 crores is being destroyed as per norms by the police department. And this 50 crore worth of drugs has been seized by the police department in the last 1 year. So if you just see this, there are two aspects here. One thing is the positive side is that yes, at least we are showing to the community that the department and the government is committed to eliminate the drug abuse, the sale of drugs and other things. But the bad news is this is a $1 billion industry, and we have been able to only destroy drugs worth 50 crores, which is just the tip of the iceberg. This is a sort of eye-opener I would like to just share with this young audience, because you are the future and you will be carrying the torch of counseling innumerable number of people in your career. And I also understand that Roshni is a pioneer as far as providing the students the best exposure and the best curriculum, the best environment to pick up the subjects and such other things. I also understand that you people are studying in one of the best institutes, and it's important to know what's happening in the field and what is the nature of the problem and the size of the problem and what socio-economic effect it can make on families. Is my voice better?
Better, sir. Better now.
It's better. Okay. So there are a lot of things as an administrator we would like to share with you people. I feel that you people are in a zone of comfort. So my request to the administrators in your college is to pitch you in the forefront of the issues where you can have a feeling or what you call a grip of the impact that this small substance abuse can cause on families, on the nation, and such other things. Was also listening to the first speaker, Thomas sir, was talking about so many things. I would like to recollect the last slide which he showed. In the entire brain, nothing remains but the substance of addiction. Such a tremendous effect it has, and it starts in a small way and goes on to wreck families. Very huge problem if you really see. In our clinical practice, we also happen to see such patients coming to us basically for clinical treatment. We may not be able to address the psychology aspects of the addiction, but we have seen in our clinical practice how they come to us and how in a matter of few years they destroy themselves and they vanish from the scene. They are nowhere to be seen. And most of them are breadwinners, and losing a breadwinner has got a tremendous effect on the family, and the family is virtually on the streets. So I would like to stress upon here the importance of knowing about substance abuse. Apart from theory you guys are going to learn anyway for the exams about addiction, the definition, the causes, and all those things. But by request to the administrators, I take this opportunity on this day to request the administrators of Roshni. I know that you are pioneers as far as your course is concerned. Can you just put the students in the field practice? Take them to the premier institutes, post them there for some time, like tertiary care centers like NIMANS. I also had the opportunity of working in NIMANS for about 5 to 6 years. Though I was working in the clinical casualty part, I was also having a look at the psychiatry patients, the psychiatry emergencies, the addictions, mainly the addictions, the psychiatry emergencies secondary to addictions. It's terrible. It's terrible, I tell you. So my request here, I take this opportunity to request the administrators of Roshni to expose the students at this stage of their career to real life situations so that they come back to the classrooms and they become more complete individuals, and they have a holistic approach to the issues that are concerning the society in general. So in this regard, I think we also had one round of discussion with all the postgraduate and undergraduate students a couple of months back, and we were trying to impress upon you the importance of tobacco control program also. So thanks for inviting me. I thank the organizers for giving us some time to share our peace of mind with the young population here. So this becomes a cocktail. What Dr. Rajni was talking is about alcohol. What Thomas sir was talking was about cannabis, heroin, and other things. To that you add tobacco. It's a ready-made cocktail. It's such a heady mixture. I tell you, it's a terrible thing. It's so attractive and so very difficult to come out of this. I was reading an article quite recently in Reader's Digest. There, the story is of a boy who grows in a bar. His father runs a bar in a remote city in US. And there the boy sits in the counter every day, and he grows there for about 1.5 decades. He grows there. And he shares his experience now. Now he has come out of that. His father passed away, the bar was sold, now he has become a normal citizen and all those things. He's not into the bar business. But if you read that story, it has come in this month's Reader's Digest. So I would request the young readers to browse it online. So even though the boy is in the forefront of the very, very attractive alcohol, he doesn't touch alcohol. On the contrary, at the current stage in life, he says, I learned a lot about the psychology of leading personalities who used to come to the bar. And he says that has made me a more complete individual, because he was able to understand the psychology of the people who used to come there, assemble there for a glass of drink. What does it show? My understanding of this story was that even though you are in the heart of the place where it is very easy for us to pick up a glass of alcohol, that boy could have picked up a glass of alcohol and he could have consumed. But still, he did not do that. He had the willpower or probably the mental strength, or I don't know, whatever it is. But he has come out of that totally without any scratch. And he says, I learned a lot about psychology of the drinkers who used to come there. So we need to have such people who are very strong-willed, mentally strong, and they don't get into this cycle of cocktail business. One good thing that what we are seeing in tobacco control program in the state is at least the smokers have come down by 6%. And the age of initiation at which the children usually start smoking, the bar has been raised from to almost 19 plus years. So these two are the small achievements that the state has made. due to the probably the intense campaign under tobacco control program by having systems in place. We did not have any systems in place. Now we have systems in place. I also thank Bloomberg to be part of the state tobacco control cell. They act as the technical support unit, and they have been of great help in putting systems in place and making us understand the intensity of the problem. So in a similar way, I request the administrators to make the students exposed to the real life situations. Let them come out of the bookish things. And if you can plan in your curriculum to post them in real life situations, it will be good. So thank you again. With these few words, I would like to once again thank the administrators and organizers, Prabhakar, for connecting us and bringing the tobacco specialist, the alcohol specialist, the cannabis specialist, all on a single platform. Thank you all.
Thank you, sir.
Thank you, sir. Our next speaker and guest of honor, Mr. Prabhakara, State Project Manager, Karnataka, International Union Against Tuberculosis and Lung Disease, New Delhi since 2013. He has 17 years of working experience in development sector, handling national program at state level like National AIDS Control Program and National Tobacco Control Program. Published papers in international journals on tobacco control program as co-author and presented in international conferences. Written handbook on tobacco control which has released by Health Minister Government of Karnataka in 2014. Has been working with the union since 2013 and supporting STCC, Department of Health and Family Welfare, in advancing tobacco control program in the state of Karnataka. Over to you, sir.
Thank you, ma'am. My sincere thanks to the principal Juliet ma'am and all the faculty members of Roshni and our deputy director Dr. M. Selvarajan, our joint director Kiran Kumar and deputy director mental health program Dr. Rajini for supporting this kind of efforts and coordinating with the premier institution like School of Roshni in this particular occasion. And second thing, I appreciate the efforts of School of Roshni faculty members and students to take up this particular campaign, tobacco-free education institution campaign, with a short notice and a little bit of support from the state cell and the union. So they have achieved this, and today they are going to declare the entire institution as a tobacco-free campus. This is one of the significant development. Madam, I appreciate your entire team for this excellent work. I have another 2-3 submission to your institution, ma'am, in continuation with what Dr. Selvara sir told. So can we do some work on BD rollers community through community development specialization students? So in Dakshina Kannada, we have a lot of issues related to BD rollers community. So, and the government of Karnataka also looking to create some alternatives for the BD rollers community. So some research or some studies to understand the BD rollers community will help us to better and to do some policy work on that. That is one submission, ma'am. Second thing, already we have discussed about tobacco-free village initiative. So, and I'm told that you have selected Mudipu village from Mangaluru city in collaboration with one of the NGO working under the leadership of Mr. Sheena Shetty. So we are happy to give all the technical supports through District Tobacco Control Cell Dakshina Kannada to create Mudipu as one of the tobacco-free village in Mangaluru city, so that we can learn from you, and we want to extend this tobacco-free village initiative to entire Karnataka. So this is also one of the activity your department can take it up, ma'am. And tobacco cessation service. So how best we can provide the tobacco cessation service to the youngsters? So because I'm sure in this group also there are many students may start their smoking or tobacco consumption or drug. So how best we can support to them in the initial days of the addiction or the habit? so that if they can quit easily. So that's why my request is to, can you start some tobacco cessation service within your campus with available resource? And we were happy to provide, and I'm directed by Dr. Selvara sir to connect your faculty members to train on tobacco cessation service by connecting NIMANS or some other experts who can give a best quality training to your faculty members to provide the tobacco cessation service. So and my team is happy to help you on this, ma'am. And third thing is we need some support for to conduct some kind of CODPA compliance assessment studies in Karnataka to see the level of the cigarettes and other tobacco products act compliance. So you used to collaborate with some other dental colleges, medical hospitals, and other MSW colleges too. So you can help us in that also, ma'am. So that's our request from this event, ma'am. So thank you so much for inviting me for this occasion and giving me the opportunity to talk about today's occasion. Thank you so much. Over to ma'am.
Thank you, sir. We will go ahead and take some time for the questions. Please type your questions in the chat box, or you can unmute and ask your questions. Meanwhile, a feedback link will be sent in the chat box. Kindly open the link and leave your suggestions. It will be maintained as a document and considered your attendance during the pledge. I request our principal to give the presidential address for the webinar.
Good evening, everybody. It has been a fruitful evening for us this afternoon, actually. We began with a session on drug addiction and tobacco abuse, as well as then we moved on to the medical aspects related to tobacco as well as drug addiction. And we have also dealt with the tobacco cessation programs that we can have and which are running in our state. And today I'm really grateful to all the resource persons, Dr. Thomas Scaria, the director of EcoLink Institute, and especially to the joint director, cum member secretary, State Tobacco Control Cell, Dr. Kiran Kumar, Dr. Selvarajan, the deputy director and Medical 1 and State Program Officer, NTCP, Dr. Rajni, Deputy Director, Mental Health Program Guest of Honor, and Mr. Prabhakara, State Project Manager. We are here today because on March 16th of this year, we met together. And that was where we began thinking about having a program like this. So the seed for declaring School of Social Work Roshni Nilaya as a tobacco-free educational institution was initiated by the talks that we had, the deliberations that we had with Mr. Prabhakara, after which we had our lot of interactions with Dr. Kiran Kumar and the resource persons of that day itself, that is Dr. Amit Yadav and Dr. Sri Devi, who were also present on that day. All these have led us to this particular day where we are here to declare our institution as a tobacco-free institution. When we thought of declaring it, it was a really challenging activity, we felt, because first of all, we need to get the consent of the students. Nothing can be forced, and nothing can be forced in the college or in the campus. So we wanted to know what is the opinion of our students with regard to going ahead with declaring our college as a tobacco-free institution. So we sent a Google form to our students, and of which we had got 419 responses. Among them, we are happy to say that 99, except two, about 99.75% of them were willing to start this initiative of being a tobacco-free institution. So that is where this can be the first step towards the prevention of also substance abuse. My wish is that let this declaration be not a formality of declaring, let it be an informed consent and a daily practice by all our faculty and our students. And this should not be only for this day that we are declaring. It should be for lifetime. And let it not be just a tobacco free. So we need to move to any addiction free campus, any substance abuse free campus, which we can look forward to. Our own students had done, I want to tell you all the dignitaries who are present here, especially that our own students had conducted some training programs for the school students. And this was pre-COVID situation where they could go to the schools. There they had, the target group was mainly school students of mostly 6th standard and 7th standard, the primary school students. And I just want to share with you what was the experience in one school where students who were placed there for field work had a PPT presentation, after which they had interaction with the students, and the students were aware of tobacco abuse because most of them said that their families, in their families they had victims of tobacco use and they were familiar to tobacco use. But they were unaware of the impacts of smoking and tobacco use. But after this PPT presentation, they had a lot of doubts to ask, and they also took a pledge saying that we will try to say no to tobacco in any form, in smoking or chewing, and also to make others aware of, their parents and their family members aware of the adverse effects of tobacco use. So even at this level as students, so this is the BSW students, congratulations to the BSW students who took this up, and the MSc counseling students also had taken up sessions with the objective to understand the perception about tobacco among students and to inform them about the physical, psychological and behavioral effects of tobacco use and to train them on the strategies to stay away from tobacco. MSW students are also initiated such sessions, and now MSc Criminology and Forensic Science students are also being involved in this program, organizing this program. So this is a collective responsibility. That's why we termed it as a collective responsibility to declare an institution as tobacco free. And I was also going through what is a tobacco free institution? What is the meaning of it? So the Google has given me the answer like tobacco-free college campuses refer to colleges and universities that have implemented policies prohibiting the use of tobacco products at all indoor and outdoor campus locations. So with this knowledge among all of us, I believe we will move ahead. We will move ahead with the support of the state tobacco control cell, and also the union who are with us with lot of programs for tobacco cessation service in the campus and the TOT for the faculty, as well as to have a program in the Mudipu village. So these are good initiatives that we can look forward with collective responsibility. And that is what we will lead to. A good teamwork will lead to the success of all these initiatives that we are taking up. And I am also sure that the Tobacco Control Committee, animated by the guidance of Dr. Sarita D'Souza, the Director, Center for Extension Services, HOD CFS, along with Mr. Sandeep, who is also the coordinator of this cell, they will strengthen the already vibrant, healthy and lively Roshni campus with this noble initiative. Let us look forward. And within a year, as Dr. Thomas has said, let us have a webinar on how effective a model campus is ours after 1 year. So maybe the team can also take up this evaluation of being a tobacco-free campus by having another webinar after 1 year and seeing how effective our initiatives have been. So with this, I declare in the presence of the Deputy Director and all the dignitaries who are present here, we declare our college as a tobacco-free institution. We will be placing the board in front of our college later. Okay, not today. When we'll be placing in 2 days, and also we would like to take a pledge today all together that we will move together in this endeavor. Kindly wait.
Thank you, ma'am. I request all the participants to turn on your camera and raise your hand to the camera to take the pledge as the principal and president of the Tobacco Substance Committee leads, and let's repeat the same.
Kindly place your right hand on the left shoulder and let us take this pledge on the International Day Against Drug Abuse and Illicit Trafficking. I, please repeat, I say your name, understand that tobacco as well as substance addiction is a disease and it has serious physical, emotional, familial, social, and economic impacts. Effects that would hurt me, my family, my friends, my institution. Given the serious after effects of tobacco and substance abuse, I accept and pledge to be away from all kinds of tobacco and substance abuse and prevent my friends and college mates from falling victim to them. I pledge for a tobacco substance-free life and to work with others to spread the truth about tobacco and substance abuse so that together we create a tobacco-free, substance-free community. Thank you. Thank you.
Thank you, ma'am. On this occasion, I would like to thank Dr. Kiran Kumar, Joint Director, for his presence in the webinar, Dr. M. Salvarajan, Deputy Director, and Dr. Rajni, Deputy Director, Mental Health Program, Mr. Prabhakar, Project Manager, the Union STCC, for being and sharing your experience with us and witnessing while declaring our college campus as tobacco substance free. Thank you, sirs and ma'am. I acknowledge the presence of our Vice Principal, Dr. Janice Mary ma'am, and our Principal, Dr. Juliet CJ ma'am, for your support and encouragement. I thank Professor Vinita, Registrar Evaluation, Dr. Cecilia Goves, IQAC Coordinator, Dr. Sarita D'Souza, Director CES, Program Coordinator and HD of Postgraduation Department of Criminology and Forensic Science, deans and coordinators of undergraduate and postgraduate program, members of Tobacco Control Committee, members of management, Institute of Social Services, teaching and non-teaching faculty for your presence. Special thanks to Dr. Sebastian, Dean, Academic and Professor of Social Work, for taking initiative to contact the eminent resource person and guest for today's event. Special thank to Mrs. Rosa Matthew, Head of Postgraduation Department of Counseling and member of Tobacco Control Committee, for conducting survey from the students and faculty of our institution to declare our campus a tobacco substance-free education institution as a part of National Tobacco Control Program. I thank the members of organizing team who took an effort to form this meet be systematic, and those who have worked behind scenes. And lastly, the webinar would have been impossible without our undergraduate and postgraduate students and my dear friends. Thank you all for making this event a successful one. Thanks again for joining us today, and we hope to see you next time. Have a nice day.
Thank you, ma'am. Thank you, Dr. Sebastian, sir.
Thank you. Thank you, Mr.
Thank you, Prabhakar.
Yeah, I'm one of the proud student of Dr. Sebastian, sir.
Thank you, thank you.
Thank you. Thank you.
Thank you.
Thank you very much.
Thank you very much.
Thank you, Selvaraj, sir. Thank you, Dr. Rajani. Thank you, Dr. Kiran Kumar, sir.
Yeah. Thank you, Prabhakar. Have a nice day.